Good morning, good morning, good morning. What's on my mind? I'm Dr. Dangleben on behalf of Patient Choice in Chemin, Neuf, Pointe, Michel. This is your daily medical tidbit. What do I want to talk about? I want to talk about hemoglobin A1C. And I've met a lot of people in Dominica. And when I bring up A1C, they're in headlines. They don't fully understand. Either no one took the time to even mention the term or even explain it to them. Right? So your hemoglobin A1C is a blood test that measures the average blood glucose over 3 months, right? And how does that work? It calculates the percentage of hemoglobin, that protein in your blood that carries oxygen, in your red blood cells, that is, and has glucose attached to it, right? So the higher your blood glucose levels, the more glucose will be attached to your hemoglobin. That is where hemoglobin A1C comes from, right? It's commonly used to diagnose diabetes and also to monitor how well a person with diabetes is managing blood sugar over time, right? Because remember, I said 3 months. So a normal hemoglobin A1C is typically below 5.7. It's a percentage, so 5.7%, but you'll just get it as a raw number, 5.7. Levels between 5.7 and 6.4 would indicate pre-diabetes, because remember, it's a snapshot of time, 3 months, right? And if you're above 6.5, that usually indicates that you're diabetic, right? So decreasing your A1C is important because that means you're lowering your average blood sugars over time, all right? This is significant because hemoglobin A1C levels are linked to serious complications. The heart disease, the kidney damage, the nerve damage, which is the neuropathy, the vision problems, which is called the retinopathy, right? And as you lower your A1C, you're reducing your risk of these complications, right? So that's important. Even if you decrease it by 1%, that can result in significant health benefits, right? And lower risk of complications. So how do you lower your A1C, right? Again, consistent lifestyle and medical management strategies. One of the most effective is improving your diet, right? Eating fewer refined sugars, right? Incorporating more fiber into your diet, focusing more on lean proteins, and if you're going to do fats, it has to be the healthy fats. Manage portion sizes. That's a big issue with me, portion control, right? And regular physical activity, right? Helps your body use insulin more efficiently, right? And if your body is using insulin efficiently, it decreases it works better lowering your blood sugar, all right? So 15 to 30 minutes of moderate exercise most days of the week should suffice, all right? And lifestyle changes is important, right? Taking medications like a metformin, which I talked about, or insulin as directed is crucial if you've been diagnosed, because many times we ignore that. And I know of some family and friends who've been diagnosed and feels like there's all other ways to do it, which is all well and good. But if your blood sugar continues to increase and your hemoglobin A1C continues to rise, you're putting yourself at risk for the cardiovascular disease, the kidney disease, etc. Monitor your sugar, all right? And follow up with your doctor. Get your A1C. Okay, manage your stress. Stress management is so important. Get out there. Find something that you love to do that relaxes you. All right? This is important. Decreasing your hemoglobin A1C is really a big step towards better and long-term health. It's very, very, very important, guys. Okay? So this is my spiel on hemoglobin A1C. Take it seriously. Ask your doctor about it. Ask your doctor to explain it to you some more, because that's what doctors are supposed to do. They're supposed to sit with you and explain these terms to you and how you can best reduce these problems. All right? I'm Dr. Dangleben on behalf of Patient Choice in Chemin, Pointe, Michel. Have a great day. Peace.